Hello there. Hi, everyone. Welcome to Facebook Live on this Monday. Today is September 14th. It's my nephew Grady's birthday. Happy birthday, Grady. All right, I'm Rendy Murphy, epidemiologist and director of disease surveillance at the Mobile County Health Department, here to give you our Monday Facebook Live update on the COVID-19 pandemic on Mobile County, our residents and our visitors, our businesses, our schools. So, just to sort of set the context worldwide, we're over 29 million cases and 924,000 deaths. You know, the United States leads the world in the number of cases and the number of deaths, followed only by India and Brazil. India has second highest cases and third highest number of deaths, and Brazil is second in deaths and third in cases. But, you know, we have probably 1.5 million more cases of COVID-19 in the United States than either of those countries. Just sort of shocking and staggering to see the number of cases that we have in the U.S. 6.5 million cases of COVID-19 with almost 195,000 deaths. And in Alabama today, the Alabama Department of Public Health has picked up by public health surveillance 139,459 cases with 2,355 deaths. For Mobile County, in our daily report, we're talking about 12,909 cases of COVID-19. 32 cases were added Sunday, 49 cases were added Saturday, and 48 cases were added Friday. So we still are seeing a low number of cases reported to public health. Just caution you that we know that what we pick up by public health is an underestimation of the true burden of COVID-19 disease, but we are still thrilled to see that that burden is trending in the right direction and going down. Last week, we added 288 cases. That's the lowest number of cases added since June. So we are really glad to see the numbers going down. And again, a credit to all of you out there that are following the mask order and distancing and doing the things that you are supposed to be doing to protect our most vulnerable populations from the complications and death of COVID-19. We're reporting on 289 people who have died with COVID. That was an increase of 3 over yesterday. We've had a couple added over the weekend. Cumulative number of patients hospitalized in Mobile County hospitals with COVID-19 is just over 1,900. That's an increase of 10 or so from the day before. And on any given day, we continue to have around 82 to 85 people hospitalized with COVID-19 in the hospital on any given day. And again, you know, for the past 10 days, we have had less than 100 people in the hospital each day with a COVID-19 diagnosis. So this is a great thing for us to see this continue downward. You know, we are just a week past Labor Day, so we are still keeping a close eye. We hope those trends will go down and we won't have a repeat of July, but we do know that there's a 2 to 14-day incubation period. So people who were exposed through proximity and parties and social gatherings on Labor Day, it will be 14 days before we would expect everyone who was exposed during that time to become symptomatic. So we'll keep an eye on that. Also want to say that the number of deaths are continuing on a downward trend, which is good news. We had 8 reported last week. We'd had a slight spike 2 weeks ago, but I'm glad to see that it is now moving back down. But, you know, deaths lag behind the number of cases and the number of hospitalizations for COVID-19, so we'll continue to watch that. We are reporting this week for the first time someone in the age group 0 to 4 who has died with COVID-19 diagnosis. We're continuing to look into that. I believe it was an infant, and we will tell you more about that unfortunate situation as we learn more about it as to whether or not the child had comorbidities or underlying medical conditions or was immunocompromised, because that is the first person under the age of 18 that has died with COVID since our outbreak began. So again, if you sort of look closely at the report, you will notice those things. But I just want to bring it to your attention because, again, this is a very serious illness for 2 to 3% of our population that have died from COVID, and then about 20% who may have complications that require hospitalization. So continue to do the things that you need to do to protect those people who are most vulnerable. I just want to highlight that the Centers for Disease Control had been sharing with us that nationally, because of schools going back, for colleges and universities going back, that the trend that they are seeing nationally, and this is certainly true for our area as well, that the highest increase in the number of cases is happening in the age group 18 to 22. So there was nearly a doubling in the percentage of people aged 18 to 22 who had COVID. It's more dramatic in the Midwest than it is in the South, but it certainly mirrors what we're seeing locally, in that it seems to be those college age kids that seem to have little regard for COVID transmission. And yes, they will likely be healthy and they will recover and they will have mild illnesses. We just need to make sure that they are doing the things that they need to do, wear a mask, social distance when they're outside of their normal household and circles, as not to inadvertently infect or pass COVID to someone that they know but have no idea may have an underlying medical condition that will make them very vulnerable to severe complications. And the other interesting thing is that, unlike in all categories where we see that we have more blacks than whites that have COVID, in the 18 to 22 age category, it's mostly non-Hispanic whites that are driving that large increase in COVID in that population. So we had a couple of questions, not very many. Someone asking about an outbreak. Had we heard about an outbreak at a local college? We have heard of several clusters of COVID illness at local colleges and universities, and in fact have received reports of students, K through 12 students from more than 50 schools in Mobile County that covers or accounts for more than 240 cases. So we know that there is COVID transmission going on in the K through 12 schools. It's probably a combination of at-school exposures and after-school exposures, because people seem to be allowing their children to go to overnight sleepovers, to birthday parties, to gather at restaurants and other places that kids like to go after school. So, please, parents, we know that your kids will likely, survive a COVID infection, but just remember that they may have teachers or church members or aunts and uncles or grandparents or siblings that are not as healthy as they are, and we want to make sure that they are protecting the people around them and not inadvertently infecting them. Other questions about, are the testing numbers going down? Because we've been telling people just to go home, not to get tested, just quarantine at home. That's probably part of the reason. Part of it is that we know there are more and more rapid kits tests that are coming available. And in fact, the federal government is shipping rapid test kits to lots of nursing homes, lots of long-term care facilities. Other locations are starting to acquire these rapid testing kits, so that also can affect the number of positive test results. Also, because transmission overall is going down, that will affect people may not perceive that they need to get tested as frequently. But again, anybody who wants a test can get a test. You can call 690-8889 to be tested for COVID, and at no cost to you. But if you have symptoms of COVID, please, 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 please go and get a test. Someone asking about asymptomatic infection. This is a little tricky. If you're infected with COVID and you don't know it, in those early days, in the 5, 6, 7 days after you get infected, you can spread COVID to others. You stop shedding the virus or infecting others after about 6 to 7 days, but we want you to stay home for 10. That's so people who recover from COVID and weeks later, they can't transfer it. It's because they've already stopped shedding the virus. So there was a question that came in, and I think it's mixing two sort of lines of thought there. So yes, once you're infected, whether you are symptomatic or not, you are thought to shed virus for no more than 10 days, which is why we want you to go home for 10 days if you have a positive test. Okay, on to what many of you may have your eyes on today, even more so than COVID. We have Tropical Storm or Hurricane Sally. I'm not sure if it's been reached a hurricane status yet. Okay, Mark is telling me that yes, it has reached hurricane status. So we're kind of rushing our Facebook Live event today because the Mobile County Health Department is going to close our doors to the public at 3 o'clock today, given the potential for severe weather entering our area later today and through tonight. And we want to make sure that we don't put our patients and staff in harm's way. So we are going to close our facilities today at 3, and we will resume normal operations on Thursday, September 17th. So please closely monitor your local news outlets, Mobile County Health Department, and Family Health social media for updates. And just remember, when preparing for a disaster, these are the kinds of supplies that you need: clean water, non-perishable food, first aid kits, battery-powered radio, flashlights, and extra batteries, sleeping bags, extra blankets, things to purify water, like chlorine or iodine tablets. Need your prescription medicines, your over-the-counter medicines, baby food, formula, diapers, some disposable cleaning cloths, personal hygiene item, emergency kit for your car if you're going to evacuate. Also, this year we've been really emphasizing that a congregate shelter should be your last option for evacuation. Please, if you have any option other than a shelter to evacuate, you should probably have already implemented those plans, but please go inland if you are in some of the lower lying areas along the immediate and local coastlines. And remember, food safety. Don't use a grill inside your home. We want to make sure we're not putting other dangers at play when we're after a storm. Make sure that you are paying attention to food safety. If you have a loss of power, some food may not be safe to eat. Again, we don't want you barbecuing or using a grill inside. Make sure that you're using clean drinking water. And then if you have no other option for shelter, there are 2 shelters open in Mobile County. So today at 10 o'clock, the American Red Cross opened a shelter for Mobile County residents who don't feel safe staying in their homes during the threat of Hurricane Sally. The shelter location is at Theodore High School, 6201 Swedentown Road in Theodore. Registration began today at 10, and you need to bring a mask and your other COVID things: hand sanitizer, several masks to bring with you if you must use that mesh shelter. And then there is a medical needs shelter that was open today at 10 by the Mobile County Health Department at Burns Middle School on 6175 Gerby Road in Mobile. Again, 6175 Gerby Road in Mobile. You have to, in order to be admitted to the medical needs shelter, you have to have a caregiver with you, someone 18 years or older. You need an ID. You need medical supplies and medication for at least 72 hours. You need food if you have a special diet for at least 72 hours. And then you need some of that water, hygiene, anything else that you use on a daily basis. And then patients with certain medical conditions will be admitted only on a case-by-case basis, like if you require a CPAP that needs power, or wound care, IV therapy, stable oxygen, a Foley catheter, functional or access needs, wheelchair-bound, ostomies, these sorts of things. If you cannot stay in your home and you have no safe shelter and you need to go to our medical needs shelter at Gerby Road, they will do their best to accommodate you there. So they will triage and admit anyone who comes again with an adult caretaker that we can accommodate there. But by all means, if you have to leave your home and you have any other options for sheltering with a family member at a hotel, with friends, please do that instead of using the mass shelter in the world of COVID. But even during COVID, it's safety first during the hurricane. So please, if you do not have safe shelter, please seek out shelter at one of those locations. So I will stop there. Our shelter information will be online, and we'll be back on Friday to talk to you about the aftermath of Hurricane Sally and the impact of COVID-19 on Mobile County. So be safe, everyone, and stay away from floodwaters. Water injuries and deaths are the #1 cause of death during hurricane events, and please stay out of floodwaters. Okay, be safe. We'll talk to you Friday.